here at eTurbo News, at Travel News Group. It's not only we publish eTurbo News, we also have a very important, even more important sector of our company, what is Safer Tourism. And Safer Tourism, it's a consulting arm of Travel News Group, and it's the head of the Safer Tourism initiative is Dr. Peter Tarlow. And I don't think I have to introduce Dr. Tarlow that much either, but maybe you can just tell us a little bit about you and how you see everything, Peter. Good morning, and he's joining us from College Station in Texas.
As we say in Texas, howdy, which is the Texas word for aloha. So good morning, good evening, good afternoon to wherever you are in the world. Thank you, Jürgen. I'll try to keep my remarks as brief as possible so that many people can have questions and everyone will have a chance to talk. My specialty, what I work in around the world for the last 30 years, is tourism, security, safety, health, and well-being. And I'd actually like to suggest that this initiative that Jürgen has begun, we might call Project Wellbeing, because it'd be a way of bringing us all together. So I'd like to take, first of all, a few of the, for those of you who are unaware of the term surety, surety is where we bring safety, security, economic development, reputation, and health together. And those come under the rubric of surety, a word borrowed from the French and from the insurance industry to try to bring the world of tourism correct. My colleague and friend who I just got to meet from Nepal, I think said it best when he said that without safety and security, there will be no tourism. And part of that was the whole issue, as we see right now, of the safety and security of the health perspective within it. When people become scared, they don't travel. But I think the world of surety has a lot of things that can be teaching us to deal with this crisis. And some of the challenges that we have. For example, when it comes to the issue of crime, we do not have in the world a standard definition of what a crime or crime rate refers to. In the same way, we're going to need, in order to be able to study these particular new challenges that we have, standard definitions. What do we mean by someone being sick with COVID? How quickly do we declare someone recovered or not recovered? Each country, each terminology is trying to use its own way. And so I think it's going to be very important, and something that we could do is try to work on standardizations of definitions so that everyone understands what the data is. We want to be data driven, but garbage in is garbage out. And if you don't have the same definition for the data, then you really don't know what you're talking about. Secondly, the tourism industry for all too often has often said, this is what we need. This is the time when we have to go from getting to giving. We have tremendous numbers of skills that we could be helping to rebuild economies. We understand marketing. We understand customer service. And those are going to be issues that people throughout the world are going to need, those skills, in order to rebuild an economy, because without economic security, there will not be any tourism. So we have to give, and in giving, we will be creating. What we're really dealing now is a question of risk management. And so we have to be very careful. We cannot overpromise what we cannot deliver. Instead, we have to be able to find ways to develop risk in a methodology that we can measure it, deal with it, and help people get beyond it. Also understanding we will never have 100% safety. We will never have 100% security. The most we can do is make the target less, and hopefully instead of having 1,000 people die from COVID, we bring it down to 10 people or 20 people. I would call that a major success. I want to remind everyone, we are talking a lot about technology, but technology at some level can only go so far. The term for hospitality is also related to the term for hospital. Both come from the Latin root to take care of. And so yes, it is very important to use smart technology. I don't disagree. But on the other hand, we tourism, you cannot have a relationship with a machine. It's hard to have a relationship when you've never met the person. You can, but it's just not quite the same thing. And so we're going to have to figure out a way to utilize technology without taking away the human quality, because both of those are going to be necessary. Now, here in Texas, we have a double problem, which is a problem that's going to be facing much of the world, and that is that not only do we have the whole issue of health, but we also have the issue of very low oil prices. And that means that the Texas economy is going to be facing some real issues. I can buy a gallon of gas now for well under $1.50. That's an incredibly small amount. That's about 5 liters if you think in the metric system. That's an incredibly inexpensive amount for gasoline. And that means that while we celebrate that on some level, it also means tens of thousands of people are going to become unemployed. And there will be other sides to that. Some countries will benefit, other countries will be hurt. So we have to think of ways that we can create economic development, utilize technology, but not lose the human element from it. That means that, and I again like the idea of calling it not the new normal, but the next normal. I would like to go one step further. I think we need to call it the next normals, because I don't think in this world we're going to have just one next normality. We're going to be going from one normality to another. And in reality, it may not be a normality. It may be learning to live in a world of abnormalities. And the abnormal may become the normal. So therefore, we in the tourism industry are going to have incredible amount of flexibility. Now, those are some of the bases of tourism security and tourism surety. The need to be flexible, to be understanding, to have a good sense of data, to understand where safety and security interact, to understand the differences between preparing people to live with good health, not to be fearful of crime, not to be fearful of terrorism. Much of the assumptions about crime went down the drain with COVID-19. Many people believe that poverty produced crime. In reality, crime tends to go down during periods of poverty because you have social cohesion. And we're seeing that now again. Crime levels in many parts of the world have dropped, even though poverty has increased. Hopefully that poverty will be for a very short period of time. Today in the United States, we talked about the fact that we have over 30 million people who are unemployed. That's an incredible number of people. If you think about the fact that in January, we had the strongest economy in the world, and in 3 months, there was almost like a balloon. Someone put a pin in the balloon and it deflated. So that means we have lots of things that we have to do. But I think that if we understand that hospitality is connected to the word hospital, it's our job to take care of the soul the way a hospital should be taking care of the body. And if we're able to do that, and we give rather than just ask, take the talents that we have in the world of tourism and apply them to a world of economics, I think then we can become a very valuable tool in the development of a new set of constantly changing normalities and a sense of inspiration that will serve us for generations to come. So thank you. I hope.
Thank you very much.